We are going to discuss about upper limb anatomy. It is the part one. Previously, we have discussed about abdominal regions, but we are going to cover the abdominal organs later. First of all, the topic which we are going to cover in this lecture are the bones specifically. Later on, we will move to the joints of the upper limb and the lower limb and clinicals later on, etc. Let's start. That the bones of upper limbs include scapula, clavicle, humerus, radius, ulna, carpals, metacarpals, and phalanges. This is the overall structure. Here is the clavicle, which is the collarbone. These are the ribs, and scapula is on the posterior side. This is the acromion process of the scapula. This is the glenoid cavity, and humerus attaches to the glenoid cavity. This is the scapula shown here. This is the humerus, the radius, and the ulna. Radius bone comes along the thumb side, and ulna bone is located along the little finger side. These are the carpal bones, metacarpals, and phalanges. This is the sternoclavicular joint, the joint between the sternum, the breastbone, which lies in the center. This is so it makes sternoclavicular joint. And here is the clavicle, which is also known as the collarbone, and it makes uh, uh, AC joint, acromioclavicular joint. Here is the AC joint or the acromioclavicular joint, and it is between the coracoid process of scapula, the collarbone, and the acromion of scapula. Here is the acromioclavicular joint. This is the right scapula posterior aspect, and this is the right scapula's anterior aspect. This is the medial border, the lateral border, and the superior border. Now locate the superior angle, the inferior angle, and here is the spine of scapula. Here lies the acromion. Above the spine of scapula, there lies the suprascapular notch, and below the spine of scapula lies infraspinous fossa. Above the spinous process lies supraspinous fossa. Okay. First of all, you have to locate the spine of scapula so that you can figure out that the infraspinous fossa lies below the spine of scapula and supraspinous fossa lies above the spine of scapula. Here is the suprascapular notch and the superior angle, and this also includes the superior border. This is the medial border and this is the lateral border. This is the glenoid cavity at the lateral angle, and the acromion process is here too. This is the coracoid process. If we see it interiorly, that this is the coracoid process, this is the acromion, the suprascapular notch, this notch, and this whole is the superior border. The superior angle is right here, and the medial border and the lateral borders are right here. This is the subscapular fossa. On the posterior aspect lies infraspinous and suprascapular notch and supraspinous fossa, but on the anterior aspect lies subscapular fossa. It is being placed there. Moving on to the humerus, that humerus is one of the major bones of the upper arm that provides structure and function. At the elbow, it connects primarily to the ulna as the forearm radial bones connect to the wrist. At the shoulder, the humerus connects to the frame of the body via glenoid fossa of the scapula. Let's see here that this is the anatomical neck, this is the greater tuberosity, this is the surgical neck. This is the posterior face of the humerus, and the deltoid tuberosity lies on the interior side here. This is the tuberosity. This is the lesser tuberosity, and this is the greater tuberosity. And between the lesser and the greater tuberosities lies intervertebral groove, and this is the humeral head. This is the humeral head, and this yellow face shows the anatomical neck. The blue area shown here is the greater tuberosity, and the green area is the lesser tuberosity, and between it lies intervertebral groove. The deltoid tuberosity is here. The humerus is the foundation to which many muscles insert, such as deltoid, pectoralis major, and others. For example, humerus support all the lifting and the physical activities. The humerus is one of the longest bones in the body. This means that it is also one of the most commonly broken or the fractured bones. Okay. The upper line of the humerus consists of the head, as I explained before. This faces medially upward and backward, as I explained here before, that this is the anatomical neck and this is the humeral head. Now, this is the greater tuberosity, and here is the lesser tuberosity. There lies the intertubercle groove. So the anatomical neck separates the humeral head and the tuberosities. The greater tubercle is located laterally on the humerus and has anterior and posterior surfaces. It serves as an attachment site for the three rotator cuff muscles, supraspinatus, infraspinatus, and teres spinatus. Now, the rotator cuff muscles comprises of four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. So the greater tubercle offers the point of attachment for supraspinatus, infraspinatus, and teres minor. The lesser tubercle is much smaller and is more medially located on the bone. It only has an interior surface. It provides attachment to the last rotator cuff muscle, subscapularis. Separating the tubercles is a deep groove known as intertubercle sulcus, and the surgical neck runs just distal to the tubercles to the shaft of the humerus. Here is the surgical neck. Okay. The shaft of the humerus is the site of the attachment of various muscles. On the lateral side of the humeral shaft is rough point surface. Which side is rough? Lateral side, where the deltoid muscle attaches. And this point is known as deltoid tuberosity. Here on the deltoid tuberosity, the deltoid muscle attaches. And it is on this side is rougher and is located laterally. The radial and the spiral groove is a shallow depression which runs diagonally down the posterior surface of the humerus, parallel to the deltoid tuberosity. Now, parallel to the deltoid tuberosity lies the radial. Immediately distal to the supraepicondylar ridges are the extracapsular projections of the bone. The lateral and the medial epicondyles both can be palpated at the elbows. So let's have a look here. This is the medial epicondyle and this is the lateral epicondyle. This is the posterior surface and this is the anterior surface. Uh, on the outside lies the lateral epicondyle and on the inside lies the medial epicondyle. This is the trochlear. This is known as trochlea. Sorry. This is the trochlea, and over here lies the olecranian fossa. Now, interiorly lies capitulum, and the radial fossa is right here, along with the radius fossa right coronoid fossa. So there are three fossas basically. Interiorly lies radial fossa, along with the radial fossa lies coronoid fossa, and posteriorly lies olecranian. Okay, and trochlear region. The trochlea is shown also here, that this green region, and capitulum. Okay. Distally, the trochlea is located medially and extends onto the posterior aspect of the bone, which articulates with the ulna. Lateral to the trochlea is the capitulum, which articulates with the radius. Also located on the distal portion of the humerus are the three depressions, which we have already discussed, that the coronoid, radial, and olecranial. Olecranian lies posteriorly and radial fossa and coronoid fossa lies anteriorly. They accommodate the forearm bones during the flexion or the extension. Trochlea or the coronoid fossa accommodate ulna, and the capitulum and the radial fossa, as the name shows, it accommodates radius. The radial fossa or the capitulum accommodates radius, and the trochlea or the coronoid fossa accommodates ulna. This diagram is already discussed. This is the humerus, this is the capitulum, the trochlea, the ulna bone, and the radius bone. Here is the head of the radius, the trochlea of the humerus, the olecranian fossa, the medial epicondyle. Here is the posterior view of the elbow joint. Okay, this is the head, humerus is the circular one, and this is the medial epicondyle on the inside, and this is the humerus. This is the posterior view, remember that. Here, ulna is shown here, the radius, the radial head, the radial are the bicipital tuberosity, the coronoid process. Here, the trochlea, the olecranian process, the medial epicondyle, the humerus and the lateral epicondyle. Moving on to the ulna, that ulna is the long bone in the forearm. It lies medially and the parallel to the radius and the second of the forearm bones. The ulna acts as a stabilizing bone with the radius pivoting to produce movement. Proximally, the ulna articulates with the humerus at the elbow joint, and the proximal end of the ulna articulates with the trochlea of the humerus. The olecranon process and the coronoid process. The olecranon process is a large projection of the bone that extends proximally, forming a part of the trochlear notch. It can be palpated at the tip of the elbow. The coronoid process, this ridge of the bone projects outward anteriorly, forming the part of the trochlear notch. The trochlear notch and the radial notch are already being discussed. We have the radial notch and the trochlear notch, and then we have the olecranon process and the coronoid process. And here we have already discussed that here lies the coronoid process, this is the trochlea, and this is the capitulum. Okay, let's see here, like this was the radial fossa, this is the coronoid fossa, and this was the olecranon fossa. Now this is the olecranon process, and this is the coronoid process, and this is the trochlear notch, and this is the radial notch. Here let's see ulna, that this is the olecranian. Okay, this is the trochlear notch, this is the radial notch, and the coronoid process is shown in red here. The tuberosity of ulna is a roughening immediately distal. It is located distal to the coronoid process. The distal end of the ulna is much smaller in diameter than the proximal end, and it is mostly unremarkable, terminating in a rounded head with the distal projection, the ulnar styloid process. This is the olecranon process here. This is the trochlea. It is also known as the semilunar notch. This is the coronoid process, the head, the neck. This is the radial tuberosity. To differentiate between ulna and radius, remember that the radius bone has the circular head. This is the radius and this is the ulna. This is the styloid process here. This is the head. And the radial notch of ulna is here. Now moving on to the radius that we have already discussed, along with the thumb side lies radius, and along with the little finger side lies ulna. We have discussed ulna. Let's see another picture, that this is ulna and this is radius. The radius bone has a circular head, while ulna has olecranial, trochlear notch, and the coronoid, all these things. Between the radius and ulna lies interosseous membrane. Interosseous membrane is located between the radius and ulna. As you can see here, it's a thin membrane. These are the styloid processes, and the radius bone or the radial bone is one of the two large bones of the forearm. It extends from the lateral side of the elbow to the thumb side of the wrist and runs parallel to the ulna. The upper extremity of the radius consists of somewhat cylindrical head articulating with the ulna and the humerus, a neck, and a radial tuberosity. Yeah, it is difficult to explain the bones from the slides, but I hope you can see the pictures here and you can understand that. Just keep in view that which side is the anterior side and which side is the posterior side, and then locate the highlight things which are being highlighted in the diagrams here, like here and here and here. Interosseous membrane lies between the ulna and the radius. So along with the proximal and the distal radio-ulnar articulations, an interosseous membrane originates medially along the length of the body of the radius to attach the radius to ulna. So what is the function of the interosseous membrane? Its function is to attach radius to ulna and wrist and hind bones. The eight irregularly shaped carpals are the most proximal bones of the hand. The metacarpals connect the carpal bones of the wrist with the phalanges. Now phalanges are the fingers, and here are the carpals. First we will study the carpals, then metacarpals, the proximal phalanges, the intermediate phalanges, the blue one, and the distal phalanges. These three phalanges, which include distal, intermediate, and proximal, are the fingers, are also known as phalanges. These are the metacarpals and these are the carpals. This bone is scaphoid bone. Okay, scaphoid, lunate, triquetrum, and pisiform. Trapezium, trapezoid, capitate, and hamate. This is how you learn the bones. Scaphoid, lunate, triquetrum, and pisiform. Trapezium, trapezoid, capitate, hamate. Sorry. So these are the bones of the hand, and you have to learn these bones. Remember the colors. That the first one here is the scaphoid, and above scaphoid lies trapezium. Okay, and here is the pisiform, and here lies hamate. Pisiform is located above almost the triquetrum. So that was all about the bones of the upper limb. I hope all of you understand the upper limb anatomy. In case if there is any confusion, you can refer. You can also refer to the apps, 3D anatomy apps, which are available on the Google Play Store. It will help you to understand more about the bones, and you will have a clear insight into the bones, that what are the you can say the structures which are located and where they are located.